Let's discuss the Chinese and Western medical thought, the diseases in Western medical thought. The history of Western medicine in ancient times was similar to that of Chinese medicine, but took a very different route in modern times. Knowledge would come from challenging accepted truths of the past and progress from scientific revolutions that challenge and replace all theories and the path-breaking discoveries following the advent of scientific medicine in 19th century Europe. Western medicine in distant antiquity evolved from spiritual belief but underwent a transformation similar to that brought to Chinese medicine by the Beijing. After the Hippocrates corpus, diseases previously thought to be linked to spirits and gods were regarded as disorders caused either by external environmental factors or internal disruptions in the body. The nature of man in Hippocratic writings, for example, states, when a large number of people all catch the same disease at the same time, the cause must be ascribed to something common to all and which they all use. In other words, to what they all breathe. However, when many different diseases appear at the same time, it is plain that the regimen, that is diet and exercise, is responsible in individual cases. This insight led to the distinction in modern medicine between diseases caused by infections and environmental factors and illnesses caused by factors internal to the body. An influential medical sect, the Methodists, introduced a new medical theory that dominated the Roman world for some 3 centuries from the Mission to the time of the Emperor Marcus Aurelius. The Hippocratic medicine had earlier tied together the part affected by disease and the theological theory to explain the disease, thereby allowing the physician to ascertain indications for therapy based on the locus of the disease. The Methodists rejected this epistemological approach, and this insisted that good medicine was simply effective therapeutic practice and it was not necessary to search for the hidden cause of disease. Thus, Methodists spoke of affections rather than disease, and did not concern themselves with theology, convinced as they were that a good doctor should never concern himself with the causes of disease. The Methodists emphasized notion of repletion, indicating excesses in the body, and depletion, indicating deficiencies. These notions were somewhat similar to excess and deficiency syndromes in Chinese medicine. Galen, whose ideas were to dominate Europe up to the end of 16th century, rejected much of the Methodists, but this view of human health was in principle not all that different. Drawing inspiration from Aristotle and the Hippocratic writings, he viewed organized human bodies like bodies in nature as composed of the 4 elements of fire, water, earth, and air, with the 4 qualities of these 4 elements being heat, moisture, dryness, and cold. Disease stemmed from abundance, scarcity, or change taking place in the humors comprising blood, phlegm, yellow, and black bile. Hence, diseases were classified according to the humor that was in excess or scarce or which suffered a defect in its movement, each of which required a different therapeutic approach. Such notions of excess and deficiency were to persist in Western medical thought, right through to modern times when their importance was eclipsed by notions of disease causation derived from discoveries in microbiology. That such notions continued to be central to Chinese medical thought is worthy of note. It is as if the dazzling discoveries of microbiology diverted Western medical science to cells and genes and held it on nosological track, neglecting the perspective of the body as a whole in relation to its internal and external environments. Chinese medicine, on the other hand, knew no microbiology and had little choice but to look at the body's external manifestations as a whole. Ancient and pre-modern medicine in Europe focused on understanding the conditions of human bodies in the grip of disease, the progression of these conditions, the pathogenesis, and appropriate therapies of healing. Less emphasis was placed on epistemological issues of causation. What made the patient fall ill in the first place? Before the 19th century, theological discussions of disease in Europe revolved largely around moral and social factors such as drunkenness, intemperance, gluttony, and dissipation. Parsley, for example, attributed diabetes to indulgence in excessive amount of cold fluid, poor living, sleeping at night in the open air in state of intoxication, sudden halting of perspiration, and mental anxiety. Thank you for your attention.